ER counseled on smoking. If a person comes to the ER with back pain and are a smoker and counseled on smoking cessation, is it correct to bill the 99406 in the ER? I've heard both. Wouldn't you need a 25 modifier on the E&M code? Also, if a patient leaves the ER AMA and does not see the physician, is it okay to code for the nurse's note? Ooh, two-part question. I can honestly tell you, I don't know the answer.
Well, the important thing with that particular code, it has to be greater than 3 minutes and up to 10 minutes. So I think it's important that you really have to document that time, just like any time-based codes, anesthesia or anything else. So that's important that if you need to provide, education with providers and other clinicians that assist in the emergency room, you will need to do so. Now, when it comes to nurses' notes, there are guidelines regarding BMI, and if they document, Decubitus ulcers or any of those ulcer conditions, they can document that. However, the provider has to be the one to use or to diagnose with a certain condition. Same thing with BMIs. We can't code strictly just by the BMI. The provider has to document obesity, morbidly obese, something like that. We cannot code, just off the nurse's notes. We can use it in assistance as, a way to perform CDI or documentation improvement with providers, but we cannot do so.
Anything to add, Jennifer?
Unless you're, and I'm assuming you're talking nurse, RN, LPN type of nurse and not a nurse
practitioner,
a CRNP. Right. Because nurse practitioner most likely is able to see a patient in the ER and bill for those services, but a nurse is not. There is not a 99211 code or anything, because you remember those also fall under supervision of a physician. So if there's no physician, there's no service.
And if you have to fall into more of the scope of practice, if it is an advanced nurse practitioner, there are each state there are certain regulations that some, like North Dakota, they can act alone. They don't need a supervision. However, in other states, it's very different. It's limited, or they can't do it at all. So you just have to take note of that. But
that's because North Dakota doesn't have enough providers.
Right. Out there. Yeah, you talk about the rural areas of West Virginia and things like that. Yeah, they allow in rural areas for a nurse to provide those services because they're understaffed. But it is a state. It would be a state guideline, yeah.
But you're not going to have that in Boston. Houston. Okay.
And you got to think, too, what did that nurse actually do for them? They probably couldn't even do anything. They didn't give them a prescription. They just took their vitals and said, okay, the doctor will be with you soon. So what are you billing?
Correct. So, even with the same as a nurse's note for the office visit, they can't do anything new. It has to be already an established plan.
Do you need more medical certification and business training? Learn more at www.cco.us.